All right, so we are live, okay? I'm gonna back up, I have everything set up, and I'm just gonna wait for a few more people before we start, okay? All right, so you guys can put in the comments if you have any questions. I'll try to answer them afterwards, okay? And then as we go through, let me know if you can't really see something as well. I'll try to do my best. A little bit nervous because it's live and we're doing a presentation, but hopefully you guys watching will get a lot out of this, and I'll try to explain as much as I can. If you guys want the presentation after, you can also email me and I can email you the slides and the presentation for you guys to go over as well, okay? So, for any of you that don't know me, okay, so my name is Michelle and I work in the Brantford location. I'm one of the exercise physiologists that are there, and I have my undergrad in exercise physiology. I have my master's in exercise physiology with a concentration in injury prevention and performance enhancement, as well as multiple other certifications. I'm dealing with everyone over 50, dealing with people who have arthritis, and special medical conditions as well, okay? So today specifically, we're gonna talk about the dangers of sitting all day, like we are doing right now, as well as what you can do to combat that, whether it's stretches, whether it's moving, things like that. We're gonna talk about stuff that you could actually do to keep it so that way you guys are moving and you guys won't have any negative side effects, okay? So, let me know, you guys should be able to read this, but we're gonna go over it as well. So the picture that is here, it's showing how you guys would normally sit throughout the day. So how you would normally sit when you're seated up. So I'm trying to see if you guys can see me if you're seated up. Over time, when we sit at a chair, when we sit in our couch, when we sit even in the car, we tend to get very slouched. So your muscles relax, you tend to get really slouched and you hunch over like this. So what ends up happening is your neck gets tight, okay? Your traps, which are up into here and that run all the way down your back, those traps tend to get really strained, and they're in different parts of your body and in your back that tend to get strained and tend to get tight. Some get overworked or over loose. Your hips get very weak. So there's multiple things. We're also going to be talking about sciatica. So what happens is when you're in this position, what happens is it closes off the space between the vertebrae, okay? So what you need to do is you need to do things that are gonna open up the space between the vertebrae. So we call this flexion, okay? Closing the space between the vertebrae, and when you're going back, opening up the space between the vertebrae. That's gonna help unpinch those nerves, okay? And we're gonna do some of those stretches as well, okay? Even too, all the way down to your feet. Your feet get flatter, okay? So plantar fasciitis, because you're not walking, you're not using those muscles tend to stay right there. Especially for guys, because they're in the same shoe most of the time. Women tend to switch up them as we go, but still the feet get flatter as we go. So over here, some other things that cause it. So like I said, nerves become pinched. So anywhere in the lumbar region, usually they get pinched, which is like your lower back, all the way down to in your sacrum, which is kind of like where your glutes are. All of those can become pinched, okay? You can even get bulging discs. So what ends up happening is as we're like this, your bulging discs bulge backwards. So I'll show you another picture as we go along to kind of show that. And then with the bulging discs, you could actually do stuff that will help. So by opening up the space between the vertebrae, which mostly what physical therapists do, they try to make that bulging disc go back in to the space, okay? So when you open up the space, the bulging disc can slide back in, and then as you work the muscles around it and you strengthen the muscles around it, you're less likely to do that again. I'm just gonna check the comments really quick. I know a lot of people are. Thanks, guys. Yeah, some people, I'm not sure why, some people it might be coming up as backwards, but hopefully me explaining it will also help you too. When I was trying it, it happened to be that it was right side. It was reading correctly. So when I was doing this, it was coming up correct. I just apologize if it's backwards. Another thing is a lot of the muscles become weak. Okay, so when you're sitting in that posture, you start to compensate and you start to become, when you have tight muscles, you also have weaker muscles. Okay, so what ends up happening is, let's take, for example, I always tell people this in the car because I have a really, really bad habit in the car. So I'm going to face you guys. I tend to drive with my left hand. So this is my left hand. So I tend to drive with my left, and I put my arm on the like middle console, and I tend to turn like this. I don't mean to do it, but I'm also hunching forward and I'm turning to the side as I drive. So as I kind of catch myself, I straighten back up. So guys, what I want you to do is, after this presentation going forward, kind of notice the way you guys sit. So notice when you're in a chair, notice when you're on the couch. Your couches are most likely soft and squishy, so you're typically gonna just hunch right in, okay? You're typically just gonna hunch right in and relax into that couch, but every so often you're gonna have to sit up. Make it a point to do that, because now that we're dealing with this coronavirus and everything, a lot of people are sitting all the time, okay? I mean, I feel the effects, you guys must be feeling the effects. And as we go through, you might actually relate to some of this stuff. You might say, oh, well, this is actually happening to me, okay? Another thing that you'll notice on here, it does slow down your digestion. So what ends up happening is when you're seated and you're crunched down, you're squishing all your intestines that are here. So sometimes, whether it's you might not be able to go to the bathroom the correct way, you might not be able to digest foods properly. So one of the physical effects is not being able to digest food quick enough or efficiently as well, which can lead to other problems. So these are multiple pictures that I was talking about. Hopefully they're a little bit bigger so you guys can see them. So over here are all of the muscles that get affected, okay? So it shows someone sitting at the desk, and then with the muscles of the chest and of the shoulders, when we hunch over, they get very, very tight, okay? So what ends up happening is, here gets super, super tight, here gets super weak, that's in the back, your back muscles end up getting weak, okay? Your hamstrings actually get shorter. So if you sit a lot, you will actually have problems with your range of motion in the knee, because from there, if you have lengthened quads and shortened hamstrings, then that'll cause a permanent bend in your knee if you don't stretch, and if you don't get moving, if you constantly sit there all the time, okay? So this just shows you up here what happens to your upper body. Certain muscles get tight, certain muscles get weak, okay? And then down here is what happens to your pelvis. So not only is your upper body affected, but your lower body is affected as well. And because everything is connected, you'll notice that your entire body feels those effects, okay? So when you're over here, even when your cervical spine, that's one of the first things to go, one of the first signs that we usually see. So if you can look at my neck, I try to put my hair up so you can see. So most of the time, our head starts to go forward if you're looking at a screen. So I'm gonna pretend that I'm looking at my screen. A lot of people looking at their phones. So what happens is if you put your phone down here, you tend to look forward, okay? Forward and down. So that here is stretching out all of those muscles, making them super weak. And because everyone's head is heavy, it's bringing it downward, okay? So that's when you notice as you get older, some people, I always use like the Hunchback of Quasimodo as an example, only because just so you can see how extreme it can get. Some people may not be that extreme, but some people can also be very extreme. But you can prevent the slowing of it. Now there are other factors, like if you have arthritis or something like that going on, you can definitely start to do that. But with the strengthening of the muscles and with the stretches, you can kind of prevent the progression of that happening, okay? So one of the major side effects, the physical effects that you guys might notice is weight gain. So if we're just sitting all day, then you're not moving. And if you're not moving, you're not burning any calories. So one of the biggest things we see for physical effects is weight gain. And with that being said, during this time, that's where a lot of people will start noticing the weight gain. So that's why we're constantly in contact with you. We're emailing you, we're calling you, just to make sure you're doing something. We'll get into more specific examples a little bit later on. But with the movement of the muscles, it also aids in that digestion. So not only is it burning calories, but you're helping things move along, you're helping with the digestion so things don't sit there, get congested, and then you have a hard time going to the bathroom, okay? So eventually this stuff can lead to diabetes, stroke, heart attack, okay? We're not trying to scare you in any way. I'm not trying to make everyone scared of sitting all the time. If some people have a job that you do sit all the time, it's just a matter of we want to encourage you to keep moving. Any sort of movement, which we're gonna give, I'll give examples later on, but we just want you to keep moving, okay? So other physical effects that people usually don't know about. So when learning, I didn't really know much of this stuff either, going through all of the schooling that I did. So what happens is when the digestion part happens, when you sit all the time and that gets blocked, like the picture, sometimes it can cause cancer, okay? Just sometimes, not all the time. But that's just if you consistently sit and not take these steps to prevent what's gonna happen, okay? A lot of people might notice varicose veins, okay? You could get varicose veins from sitting all the time. The blood just pools in those veins. But if you're constantly moving, constantly stretching, you can also prevent that from happening. Deep vein thrombosis, sometimes when you sit for too long, a blood clot happens. That's why when you're in the hospital, if you have surgery or something, they put those massagers on your legs to keep the blood constantly moving so you don't get blood clots. So even if you were to sit at your desk all day, just crunch your toes, okay? Like open and close your toes, move your ankles around. Just by doing those little tiny things, you'll get the blood flowing, pumping back to the heart, coming back to all your extremities and so forth, okay? So it just starts from a little motion, even if you're just moving your hands, okay? Your hands and wrists, from your feet to your toes, moving those around, that'll be a major part in the preventing of the varicose veins and the deep vein thrombosis there. Sometimes it can cause heart disease, but a lot of times that's attributed to when you gain the weight. So if you are not moving as much and you're gaining a lot of weight, a lot of times it is correlated to see that heart disease happens because of the weight gain too, okay? Some psychological effects, some of you might be feeling it. Me personally, I know I'm feeling it, anxiety and depression. So you might notice that with anxiety and depression, even if you never had anxiety and depression before, which majority of the people do, but even if you didn't, this time that's going on, because we're not socializing with people, because we're not doing our every day-to-day things, it typically gets very hard on us emotionally. So that's why by doing something different, getting moving, all these other things, by switching up your routine is gonna have it so that way you don't get the anxiety and the depression. If you're not getting outside and going for walks, then you can be, when you're sheltered inside, you can get depression, okay? Anxious, anxiety, when is all of this stuff going to open back up? We have no idea. So what's happening is your anxiety levels going up, your depression levels going up, which eventually causes more and more effects. And it's constantly builds. So we need to break that up and we need to figure out how we can do that. Okay, so I'm going to give some examples, and then if you have more questions and you want anything, you could email me, let me know. I'll put my email up afterwards so that way you guys can see. All right, so get moving. Okay, so this is great examples that I want to give you. Some people just think that all we want to do is push on you, exercise, exercise, exercise. That's not all that we're trying to do. Okay, so yes, we're encouraging you guys to do your exercise programs that each of us have given you, but even if you can't do those exercises, we want you to do something else. So for example, get moving outdoors, okay? And all of this is gonna help not only with the physical effects, but the psychological effects as well, okay? Go for walks. I have a dog. I take him on walks. My husband and I, we go on walks together after he gets out of work and after I get out of work. We go to the park together. We live right by a park, okay? Even if it's something like gardening and yard work. I know a lot of you guys like gardening and yard work, okay? So I personally, for all of you that know, in Brantford, I kill plants. So I don't really know how to take care of a garden. So that's one of the things that I want to get into as we're here. And what I really want to do is I'm having one of my friends show me kind of how to do that. So when I do take my breaks from sitting all day, because I'm working at the computer and whatnot, I want to be able to go out and grow some vegetables. I want to get moving, be able to possibly put some plants in my front yard. So my friend is going to be helping me with that because I'm trying to get into some more active work outside of the house. When you get active at work, so once we always get back to work, you can do a couple of things. So even if you're working from home, what you guys can do is stand up during a conference call. I did that today, okay? I propped my computer up nice and high, eye level, and I stood up, okay? That's something that's really, really important. I made sure all my muscles got to stretch, okay? So you can do something as simple as standing up. You can do something as simple as the toes and the ankles, like I was saying, moving those toes and ankles around, all right? As well as something what not a lot of people like doing. They usually go for if you guys have like a coffee maker in your office, they'll go for the one that's right there down the hall, super easy to get to. But from my experience at being at General Electric, I used to work at General Electric, they have multiple different coffee makers all over the floor. So what you want to do, if you have time to take a break, go to one of those coffee makers that's at the other end of the building, okay? I've even heard of examples of people going on different floors, so that way they can also take the stairs to go get coffee to come back down. So change it up and don't necessarily, when you guys go back to work or even like during the day, if you want, you can go get something to drink at another store or another restaurant. Don't necessarily do the same stuff. Break up the ritual, okay? Be active indoors. So while you're indoors, some people like yoga. When pools do open up, you can go to a pool, you can do swimming. Household chores are really important. So I put up a new backsplash in my kitchen. I absolutely hated the one I put up, so I put up a new backsplash. Just doing things that are a little bit more active. Some of you guys like to declutter, so like a spring cleaning. If you guys are like that, make sure you get moving, organize things. If stuff is down in the basement and you need to bring it up, do you have lawn chairs that you guys need to bring back up? Okay, so put that outside, lawn chairs outside. I put my fire pit outside, something else to keep you moving. The goal is I'm just trying to give you examples so that way you continually move, okay? So now that we get into the importance of stretching, okay, it keeps the muscles flexible. okay? And also strong and healthy. What happens is, as you sit there all day, specifically, let's just take the hamstring. So as you're sitting there, your hamstrings tend to shorten. So when they shorten, eventually over time, not only do they get tight, but they get weak, very weak, okay? So you don't want your quads being strong and your hamstrings being very weak. That throws things off. That throws our gait off. That throws a lot of things off physiologically, the way we stand, the way we walk, the way we do things. And what we're gonna have to do is make sure that everything or all of our muscles are stretched, so that way one doesn't get tighter versus the other. Now, what ends up happening, so you can see here, these are just pictures that I have for you guys, but without the stretching, that's why we really emphasize it when you guys are done with your exercises at the gym, okay? Because without stretching, you're at risk for joint pain. You're at risk for strains, muscle damage. So some people think that, oh, I'm done with my exercises, I can just go home. But what ends up happening is your muscles, it's almost like you have a shock to your system. They end up, when you go and sit back at home after the gym, they end up getting tight again, okay? And then when you go and move or do something, you can either strain something, you can sprain something. So that way, if you ease your way in what we do call an active cool down, then your muscles aren't like, what are you doing to me? What are you doing to me? They're not in shock and they won't tighten up, okay? Also too, so that way you're not as sore the next day. You might have noticed one day you forgot to stretch, or one day that you did stretch. On the days that you don't stretch, you're gonna be more sore the next day, okay? Your muscles take a pretty hard beating when you're in the gym. A lot of you guys do a lot of hard work. So we really want you to stretch after, so that way you don't get that sore, okay? So some people are like, well, where do you start? Some people have no idea where to start, and some people already know. But when you think about stretching every day, now I'm wondering how many people stretch every day? Now, consistently every day. Usually we say 2 to 3 times a week, but if you get in a habit of doing it every single day, that'll also work. I know some people who have back issues, they stretch in the morning before they get up. I know people coming from physical therapy, I know people who have had replacements, joint replacements, they need to stretch in the morning to get going. So it might seem overwhelming to some people to stretch every single day, but if you get in the habit over time, it just kind of becomes a routine. Just like how you guys have a routine at the gym and you make a schedule with us, if you make a routine of stretching every day, whether it's the morning, whether it's before you go to bed, getting into that routine will be a lot easier, okay? Now, you don't have to stretch every muscle that you have. Because we have so many muscles, some people think it's gonna take forever to stretch the muscles in the body, okay? But what we focus on, or what we like to try to focus on, is the biggest muscle groups, and sometimes with the stretches, you get multiple muscle groups. So as you'll notice, when we get to our stretches, what ends up happening is you're gonna hit more than 1, 2, 3, or 4 different muscles, so that way you don't have to do one at a time, so you can get a good stretch done between 10 and 15 minutes. Now, some people like stretching longer. If you're more prone to being tight, you can absolutely stretch longer. We just say when you hold a stretch, hold it for a minimum of 30 seconds. Anything less than that, you're not allowing those muscles to completely relax, those ligaments to completely relax. What happens is they'll end up tightening right back up again, okay? So a minimum of 30 seconds is gonna allow them to relax. If you do something like more than a minute, then from there you could always overstretch. So that's something as well. We don't want people to overstretch. If you do it too fast, if you stretch too fast, what will end up happening is you can tear something, okay? And again, overstretching of that muscle, overstretching of the ligaments, so nice and slow. I know in your head counting to 30 seconds seems like 5 minutes, but 30 seconds is very important. Okay, when we were younger, like growing up in sports, me specifically, we only stretched one muscle for like 10 seconds. But we did other active warm-ups as well. Okay, plus kids have a shorter attention span. 30 seconds can be a lot, but now, especially for you guys, for the demographic that we're in, you guys really need to stretch at least those 30 seconds. Okay, so stretching goals and guidelines. So like I was saying, it's reducing muscle soreness. You reduce the muscle stiffness as well. So even if you don't do an exercise, but you want to stretch one day, from sitting in this position, your muscles get so stiff that you have to gently loosen them and loosen them. I know a lot of people who have back issues, if they go from a seated position to a standing position, they'll feel it. But you have to think, that's because your muscles, you were so used to sitting like this, that as soon as you get up, you are pinching you're contracting your glutes. You are opening up your hips, okay? So doing that can be a lot on somebody's body, okay? So that's why we say when you transition like that, you want to do it nice and slowly, especially if you're one that's in the category of you have the back pain. If you have any tingling down your legs, any numbness like in your toes, sometimes it feels like, we say if you were to take a lighter and turn on the lighter, and if you were to feel how that feels on your skin, if you hold it, sometimes people feel that in the lower part of their legs. That's usually an indicator that there's a pinched nerve, okay? If you go from a sitting position to a standing position, and that also hurts, if you feel like a shooting pain, whether it's a lightning pain, whether it's a dull pain, sometimes people who feel it in their lower extremities, that could either mean bulging disc, herniated disc, or pinched nerves. So there's a lot of symptoms that you guys have to look out for, okay? And it makes it so that way I'm always in the gym with the members. A lot of you guys know I'm trying to figure out if someone has, I would say, like a sign or a symptom of something. I try to correlate it with, okay, what kind of pain is it? Dull, sharp, is it shooting pain? That sort of thing. So I can figure out, okay, if it's a bulging disc, you might have a short burst of pain, but it might be a longer burst of pain if that nerve is always pinched. Okay, so it just depends. If you guys have any questions on that, you could ask me. If you guys have been to physical therapy, you might be understanding what I'm talking about. But we want you, when you're in the gym, to kind of notice what you're feeling when you're in there. And then also too, if you're sitting all the time, notice what you're feeling as well. If you're noticing yourself starting to hunch over, one of my first symptoms is in the back of my neck. So I have degenerative discs in 2 of my discs. I ended up getting whiplash a few years ago. So my first symptom is tingling. It's like if someone was tapping you on the back, like little tingling right in my neck. I know those muscles are getting tight. My head is too far forward. So I'm going to tell you guys to kind of think about what your body is doing, okay? And again, stretching for about 10 to 15 minutes daily for those total benefits. Now this might be very blurry, but I put it up there in case anyone wants me to send it to them. Okay, so this is what we kind of use as far as recommending people to stretch, okay? So for example, here, okay, you have older adults and you have most adults. So older adults, 30 to 60 seconds, we want you to hold that, okay? It's more important the older that you get, okay? Especially because of the older that we get, a lot of people tend to sit a lot more. You were active when you were young, and then as you get older, you tend to sit a lot more. And that might be a reality, but if you stretch, you prevent all of this stuff from happening, okay? It shows a pattern of 2 to 4 times. You don't want to just stretch a muscle one time for each. You can stretch one and then rotate and then go to the other, but make sure you go back. So we usually tell people that what you want to do is you want to do it 2 times on each side. Some people, you can do it up to 4 times on each side, depending on how bad of tightness that you have. And again, I could always email you this. It's just a guideline of what we use. So that way we tell you guys like how to stretch, how long to stretch. It's more of a chart for us to see frequency, intensity, how long to do it, how much to do. So, okay. So now it's time to stretch. So I'm gonna end up moving my chair a little bit so you guys can see me. Okay, you guys are gonna need a chair to sit in. If you're at a couch, that's great too, but mainly a chair, dining room chair, dining table chair, that's fine. Even an office chair, that's fine as well. We're gonna start from our head and we're gonna walk all the way down to our toes, okay? I'm going to give a stretch that's a little bit more challenging, and I'm gonna give a modified stretch. So you choose which stretch you want to do, okay? I want to tell everybody that I'm not an expert, I'm not a doctor, but I'm just trying to show what knowledge I do have, okay? And if you have any pain at any time, then you please stop, consult your physician, okay? Only do what you can do, know your body. We say if there is a scale of 0 to 10, 10 being you feel like your arm is gonna pop off, and 0 meaning you don't feel any stretch at all. We want you to be about a 6 out of 10. So we want you to feel a stretch, but not have it be too much because we don't want you to overstretch. Okay, so keep that in mind as we stretch. All right, so 2 things that you can do. I'm also gonna show them. I'm gonna move my chair. Okay. So you can look at the picture and you can look at me. I'm gonna show both ways, and we're actually going to go through this, and I'm gonna count, I'm gonna hold it. We're gonna do 30 seconds each side, 2 times on each side. So you have a couple options. So the first option, so one hand down, doesn't matter which one. The other hand on your head, look straight forward. It's great because you guys can look at me, keep your eyes looking at me. And then you give a gentle pull, okay, of your head. Don't think you have to go as far as I can, okay, because for me, I am double jointed, so I'm very flexible. So for me to get a stretch out of my muscles, I need to almost overdo it because I don't feel it. Otherwise, my muscles will stay really tense. So your first option is where you give a gentle pull sideways. If that's too much, hand on your chair and just tilt sideways. So instead of pulling your head, you're just dropping your ear down to your shoulder. And you should feel it all the way in the side of your neck, okay? This is what we call it, works your upper trap. So I have the trapezius muscle. This is one of the ones to get tight because it goes all the way from like the base of your skull, and part of it comes all the way down to like outside shoulder. Good. So whichever one you decide to do, let's switch. So come back, okay? Whether it's grabbing onto the chair or just having your arm straight down. I'm gonna do this one next, okay? And then we're just gonna gently pull. Notice if one side is tighter than the other, okay? We always have one side that's tighter than the other because we always compensate. So for me, like I was saying, my right side is always tighter. And that's because when I'm riding in the car, I tend to compensate and I shift my weight. So this side is the one that's always tighter and it hurts a lot, okay? We're gonna go back to the beginning. And we're gonna stretch. Try to see if you can get a little further this time. If not, it's okay. Make sure you're breathing, deep breaths. And as you do this, try to stick your chest out so that way you're not hunched over. by sticking your chest out, you get more of a stretch in that neck, okay? For every stretch that I give, there's always a stretch that's more intense. So if for any reason you're not feeling it on the harder stretch, okay, I could always send you some that's even harder than that stretch. For example, I'll give it to you, but don't do it if you can't. So if this one, holding your head, was perfectly fine, now try taking this one, put your arm behind your back, and then pull, okay? Putting your arm behind your back stretches out the muscle even more. Now, if you're unable to do the modified version, I could even give you something easier. So we're only gonna go through 2 for each muscle, but what's gonna end up happening is if you need something harder or you need something easier, you let me know. I'll create something called an HEP, a home exercise program, and I can email that to you. Okay, so now we're back on the other side. Gentle pull. Again, you might notice that this time, maybe you can pull a little bit more. Keep your chin looking straight forward. You guys are doing great. Okay, so now we're gonna move on to the next ones. Okay, so your upper back stretch. Okay, so now I'm gonna turn my chair. You can stay seated exactly where you are. I just wanna make sure that I get a good view so you guys can see, okay? So clasp your hands in front of you, okay, like this. Arms are straight. The higher up, if you have shoulder problems, bring your arms down, okay? Every position works a little bit and stretches different parts of your back. So play around with the height of your hands, okay? And what I want you to actually what I don't want you to do, don't do this. Don't reach forward, okay? Watch my upper back. I want you to push, okay? So you're trying to push that upper back outward. Like this, okay? And you're gonna hold it and put your head down. So that's the first one. So keep your head down and relaxed and just listen to me if you're doing that one. If you have too many shoulder issues, okay, you're just gonna hug yourself wherever you can and then relax down this way, okay? Head down. And again, in your upper back, in your thoracic, your middle back, this is helping stretch all of those muscles. If you're someone that needs to actually read how to do them, okay, I can send you this, okay, so you can go through on your own. You could either look at the pictures or you could actually read. There's just the descriptions that are next to it. That's everything that it is, okay? Relax, and then we're gonna do it again. All right, so make sure you're sitting up nice and tall. I'm gonna do this one this time. Interlace your fingers, push your back outward and your chin down. As you're holding that, just focus on your breathing, okay? Okay, so now we move on to the next one. So these 2 are for your arms. So if you're someone that works at a computer all day, if you're someone that works in a trade where you constantly have to be working with your hands, like a construction worker or anything like that, we're gonna do 2 different stretches. This gets your entire arm, from your fingers to the palms of your hand to your forearms, all the way up to your bicep and tricep. Okay, so I'm gonna turn this way. I'm gonna show you with this hand. So take a hand, palm towards me, okay, so towards the camera. Other hand on the fingers. Gently pull back. So I'll show you from the side. So you can see, just gently pulling back. Now you can do this way. It's the same if you do it this way, okay? As long as you're pulling your fingers back. You might even feel it. So this is good if you have tennis elbow, golfer's elbow, carpal tunnel. All of these different things that you may have, the stretches will work for. And that's something, if you do have a specific condition that you're finding maybe we haven't talked a lot about in the gym, or any of us haven't talked about, email me and I can specifically email you stuff, whether it's exercises, whether it's stretches based on your special condition that you have, okay? So now we're gonna switch, other hand, okay? Pulling back those fingertips. Focusing on the breathing. What's good is when I stretch, I don't know about you guys, but when I stretch, because I'm focusing on the stretching, it takes my mind off of other things. So the psychological piece with the anxiety, with the depression, it helps in that aspect because you're not thinking about what's going on in the world. You're thinking about, I need to stretch, I need to hold my hand this way, my arm this way, pull back this way, hold for 30 seconds. So you're constantly thinking about other things than what's going on in the world. So other than watching TV, I mean, you can do this watching TV, but at least this will kind of break up the monotony of the day and get you doing something else to help with that psychological piece. So now we're gonna switch, but this time you're gonna put your hand downward, okay? Then you're gonna pull your fingers towards you. So you're gonna grab onto your fingers, pull them towards you. Again, if this hurts, just lightly press on your hand. There's always modifications that you can do. Do what feels comfortable to you. If you, for example, can't do any of these at all, then you could just skip it, grab some water, and we can, when we move on, you can pick up right where we move on as well. Good, we're gonna switch. Other one, hand down, gently press. I don't know about you guys, but so I live in Meriden, for anybody who doesn't know, and it was actually snowing this morning, which was crazy because right now it is beautiful, bright, sunny, people are outside. I couldn't believe it. I absolutely couldn't believe it. Just how crazy this whole weather is. I mean, I got about almost maybe an inch where I am, and it was amazing. All right, so now what we're gonna do, we're gonna go back to those ones, okay? We're probably gonna do about 30 seconds again, okay? Fingers up. If you need to, look at the screen, otherwise look at me. You could always lower your hand. It works just the same, okay? It's less of a stretch if you move your hand down and your arm down than if you have it up here. Good, switch. Pulling back the fingertips. Hopefully everyone had a good Easter if they celebrate Easter, Passover, I think Ramadan, anything you guys celebrate. I hope you guys had a good one. I know it's hard not being able to get out right now, but fingers crossed everything is looking up. It's exciting. Good. Now we're going to switch. So arm down or hand down, gently press back or pull back, whichever one. Also, while you're in this position, make sure that you're trying to tighten your abdominals, okay? So I want you to think about, even though we're stretching the arms and the upper body, the lower body, the core is also engaged, okay? That's what I want you. I don't want you to be like loosey-goosey all over the place and just let it fall everywhere while you're trying to do an exercise. I want you to engage your core as you do it. So let's switch. We're almost done with this and we're moving on. So stuff like this would be great for you to do every day. So for example, if you were to print this out and just go run through it once a day, that would be excellent, okay? Now, if you have more back issues, I can create a program with more back issues, a stretching program, but there's so many things that either I could do or that the exercise physiologists that work at your center can do. This program, this home exercise program that we have online, there's thousands and thousands of different stretches that we use, okay? These are just a few examples. Okay, so now with this one, you have a couple like different ways of doing it. So I'm gonna move forward, okay? So you guys can see my chair. So I'm going to give you two options. First of all, you want your feet flat on the floor. If you cross them, you're going to feel one side of your back more stretched than the other. So I want your feet flat on the floor. If you have shoulder issues, hands on your head, okay? And I want you to come nice and close. So you could even put them on your head here, okay? Or you can put them on your neck, but nice and tight, nice and close, okay? And then from here, you're just gonna lean back. If you don't have shoulder issues, okay, so I'm gonna do that one. Hands behind your head, open up your chest, okay? So you're trying to push, squeeze your shoulder blades, push your elbows back. So you're opening up your chest. This position of my back here, it's opening up the space between the vertebrae because we're in extension. Okay, so you want to just arch your back. If that's uncomfortable, I'll show you now. You don't have to go and grab it. What tends to happen is, so when you sit day to day, because you're in that flex position, if you roll up a towel like this, okay, and you put it on your low back, this is going to have it so that way it gives a little bit of your low back extension in it. And with that extension, causes the vertebrae to open up and open the space between the vertebrae. I've had people use a like crumpled up water bottle. So when this person specifically, he was driving and he was just so uncomfortable because he was driving all the time. He would take his water bottle, just place it back there so that way he got a little extension in his back because his normal job was usually hunched over. So that's something you can do, okay? Right in the low back if you need it, okay? And now we're just finishing up with the spine mobility, okay? All right. So now that you stretch the front part, now we have to stretch the back, okay? So for a low back position, you could see the pictures, okay? You're gonna have your feet nice and wide. I know you can't necessarily see my feet, but put your feet in your knees nice and wide. Hands go on your knees. And what you wanna do is Gently relax every vertebrae that you have so that way you roll forward. So as you look at me as well, okay, slide your hands down, relax your head, and when you get as far as you can, just hold it there, okay? So what you want to do is hold it there, and even though I'm talking, hold it so that way you feel all the muscles down your spine stretching, your low back is stretching, because even though you're in this position seated, when you stretch, you're still stretching out those muscles, and that is okay. When you do an exercise in flexion, if you were to do an actual exercise, I know some people that are watching, they can't do a flexion exercise, and that's fine. But when you do a stretch and it's stretching out those muscles, it's completely different than an exercise in flexion, okay? So that's what you have to kind of think about, depending on what your back is telling you and depending on what condition your back is in. You might be able to do a flexion stretch, but not a flexion exercise, okay? If the first one is too much, I'll just quickly show. When you're here, arms across your chest, if you're doing it great, and you're just pushing your back out, and you're trying to curl up into a ball, but not do a crunch. So this time you want everything relaxed, curl up into a ball, so that way you really get all of your back stretched that way. Now when you come up, slowly come up. So almost like in yoga, slowly come up so that way you slowly open up that vertebrae as you come up. Okay, you don't want to do it very fast. All right, so now is where we get into torso. Okay, torso, lats, obliques. Okay, so a lot of times we do this in class. One hand on your hip, okay, one arm up, and then you're just gonna gentle lean to the side, okay? So you're gonna end up feeling it here because this is the one that's being stretched. If you can't put your arm above your head, if you have shoulder issues, arms across, and just twist. This will get your mid-back the most, okay? Your mid-back, your lats that are there, okay, on the sides, your obliques that are on the sides. So you're on this side, keep holding. Good, back to the center. And now to the other side. Again, I'm gonna keep showing both ways, but whichever way is more comfortable for you. Make sure that it's a 6 out of 10 on the stretches. Don't overdo it, okay? I'd rather you underdo it for the first time, and if you have to go and play it back at another time, then you can do it a little bit more if you feel like you can do a little bit more. We're gonna go back to the first side again. Focus on that breathing. Now when you get this down and you get a routine down and you can kind of go over, I mean, I know I'm doing a lot of talking, but when you get this down, it should only take about 15 minutes or so. Back to the other side, last one. see we're working our way down. We started at the head and neck. Now there are tons more, okay? Please ask questions if you really want that, okay? Because there are tons more. I'm just showing you the generic, whether it's you do this in the morning, you do it at night, whether it's you do it after your exercise. Generic is what I'm showing. Anything else that's in detail, please let me know and I can give you much more detail if you would like. Okay, so leg stretch. I'm gonna show you 2 ways, okay? First way is, because you can't see my feet, so I'm gonna show you the first way. Your heel is on the ground, so one leg is bent, my left leg is bent, my right leg is straight. Hands are on my hips, okay? And what you wanna do is bring your torso down towards your thigh. I'm gonna stand up to show you. So I'm gonna put it on a chair. If you feel comfortable, put it on a chair, hands on your hips, and then come down. I want your hands on your hips because I don't want you to think that you have to touch your toe. That's not the point. Everyone's limbs are shorter or longer, they're all different. So what I want you to do is hands on your hips and just make sure you really feel the hamstring, the back of the leg stretch here. Okay, and we're gonna hold that. We're gonna make sure that we do this twice on each side. So whether you're sitting, whether you're standing, make sure that we're gonna do it 2 times on each side. So we're gonna switch to the other side. Okay, if you need to hold on to something, you can as well. Torso down until you feel like the 6 out of 10, that stretch. Keep in mind, one side is tighter than the other. Keep your back flat when you do this. Don't hunch. I want you to keep your back flat so that way you squeeze your shoulder blades, pushing your chest out, and you come down rather than hunching over. Good, everybody, let's switch. Okay, you're gonna switch to the other side and you're gonna hold it. Okay. Another thing you want to make sure you do is make sure that you are hydrated, okay? To keep the muscles, the ligaments, the fluid between the joints, constantly having water through them. If you're dehydrated, you might notice that you might be a little bit extra sore that one day, especially if you have arthritis, okay? So what you want to do is stay hydrated so those muscles, ligaments, joints, those are all hydrated as well. We're going to switch. Last time on this side. We are almost done, guys, okay? Okay, almost there, we're moving down. Okay, so now we have the hips, all right? So this one we're only gonna do 1 time on each side because there's 2 stretches. Feel free to go back and do them again, okay? That is okay. Like I said, for time purposes, we're just gonna do 1 time on each side because there's 2 different motions. One where you pull your knee up and then one where you push down. So I'm taking my right leg, you could take either one, okay? Put your ankle on your knee if you can. If you can't, cross it over like this, okay? This will still give you a stretch, okay? That's why I was constantly crossing my legs like that, because it will give you a stretch. If you can't do that, again, I can email you a different way to do it as well. But we'll do ankle on the knee, okay? And the first one will be pushing down. So your hands, okay, gently around the joint. I always say do not put pressure right on the joint. That's always bad, okay? So I'm gonna put my hands kind of around the joint on my thigh and my calf here, and just gently press down so you can see my knee moving. And with this, you're gonna feel it on the inside of your hip. Now, some of you tend to be tighter on the outside of the hip. Some people are tighter on the inside of the hip. But when you sit throughout the day, your hips on the inside get really, really tight. And this is just one way to stretch them. And since we're here in this position, we're gonna go right into the next one, so that way we don't have to keep flip-flopping. So we're gonna hold it about another 10 seconds or so. Gentle push down. You core nice and tight, sitting up nice and tall. Again, you don't wanna hunch. And you'll feel it on the inside of your hip. Now what you'll wanna do is gently pull up towards you. If you want, you can give it a hug. I like giving it a hug. Otherwise, gentle pull in. This you'll feel on the outside of your hip or your glute. For people who have sciatica, this one is really good, okay? Because what happens is the muscle that is tight is in your glute, the piriformis, and it's pinching on that nerve. So this is just one of the ones to help with that piriformis if you have sciatica. Good. Now we're gonna switch. So opposite ankle on the knee. This is the one we are gently pushing down, okay? Gently push that knee down towards the ground. You'll feel it on the inside of the hip. Focus on your breathing. Less than 10 seconds, and then we're gonna go the other way. Good. Now pull that knee in towards your chest. You're either pulling or you're hugging it in, okay? And then you wanna hold that. Again, you're getting your glute or the outer part of your hip. That's where you should feel it. If you need a stronger or more difficult stretch, you could ask one of the exercise physiologists that's been giving you your workouts and everything. We have tons of different exercises, stretches. Okay. All right, so IT band, very, very, very important. A lot of people get very tight IT bands, okay? So just like it is in the picture, I'm gonna move my chair, okay? I'm just blocking the words because some people were saying that it was backwards, but I'm explaining to you. Again, if you need the words, I can send these to you. So at least you can see the picture. So I'm holding onto my chair here if you can't see, okay? What I want you to do, okay, is I want you to put your, if you're holding on with your left hand, I want your left foot in front, okay? Right foot in back. And you're just gently turning to one side. You're pushing that hip out, and you're gonna wanna feel it. Some people, if they're tight, you're gonna end up feeling it all the way from up here on your hip down to the side of your knee, okay? That's where that IT band goes, and it typically gets tight really quick because it's something called fascia. So not necessarily a muscle, but the fascia gets really, really tight. That's there. Okay. Stand back up and then we'll do it again. I'm just doing both on the same side so you don't have to flip-flop again. Okay. Gently push that hip out. And again, if you're on the left side holding on, your left foot is in front, your right foot is in back. Just gently pushing out. Okay, now we're gonna switch. I'm just moving the chair for now. Okay, so I'm holding on with my right. My right foot is in back. Left foot is in front. Gently leaning. Okay. And again, you should be able to somewhat see that picture behind me. So just refer to it because you can't see my feet. So you should be able to see the feet on that person. Relax. We're gonna do it one more time. Make sure you're standing up nice and tall. Gentle lean. If this feels uncomfortable, don't do this, okay? I have many, many other IT band stretches you can do. Just not going through them today, so I can send those to you. I just like to keep reiterating it because I don't want you to do something that's too painful for you guys, okay? I want to be able to give you a stretch that you're able to do pain-free, so that way you get a good stretch out of it. All right. Next one is the calf stretch. So I am gonna face this way so you guys can see. Okay, so I want you to be able to see the picture. One foot in front of the other, just like this lady is doing. Okay, holding onto the chair. And then you're gently bending that front knee. Leave the heel of the foot, okay, and of the back one on the floor. So your back foot stays on the floor, even that heel. You're shifting your weight forward, bending the front knee, so that way you feel it. Refer back to that picture since you can't see my feet. I'm doing exactly what she's doing right now. You'll feel this in the lower calf, but you're getting your ankle and your foot stretched as well. Okay, so now that we're working our way down, we're getting the ankle, the calf, the foot, all to be stretched out at the same time. Good. Now we're going to switch. Again, the one that's in the front, you're going to be bending that knee forward, keeping your heel, the back, the foot that's back, keep your heel down on the ground. Your leg nice and straight. Shift your weight forward. And feel that stretch in the calf, the ankle, and the foot. So for time purposes, we're not going to go through that one a second time. But again, if you would like to, go back and do that calf stretch one more time on each side. Okay? So what I'll also do in the comments is I will put my email for you guys to email me. Because what I did is at the very end, I put my email. And so what I just want to be able to, for you guys to see, I'll put in the comments, I'll put my email, okay? Next one, I'm not gonna hold on, but you could hold on to the chair, okay? And so you guys can see you have two different types of movements. So one is where you grab your ankle or your knee, ankle or your foot. Keep your knee right next to your other knee, okay? Gently pull back on your foot so that way you feel it in the quad. You'll feel it in the front of the leg. Because you're sitting all the time, or you might be sitting all the time, you might feel this in your hip flexor in the front a little bit more because your quads aren't as tight as your hamstrings. So again, because your hip flexors get tight, you might feel it there a little bit more. If you need to, you can put your foot on the back of the chair, okay? Or you can put it on a couch, okay? If you need to go back over this, you can. You can put your hands on a chair, and then if you can't reach your foot, you can put your foot on another chair or maybe the couch. That would probably be your best option to do. And again, today we're only gonna do one time on each side, normally at least 2 times on each side, okay? So we're gonna switch. Now you go with the other one. I also personally like to work on my balance doing this. So when I do this, I try not to hold on because I want to work my balance as well. Just to hit like 2 birds with 1 stone. Just about 10 seconds left. You guys are doing great. We're almost done. Okay. So these are just the references. This is where I got most of my information. Not only my knowledge, but just to back up what I was saying. If you guys want any of the references, I can send those to you. A couple of them were articles. Okay, so I could always send you guys the articles if you want to read them. And that's my email, okay? So again, I'll also put it in the comments, but I'm putting it up so that way you could either write it down, or when you play this back later, you could at least take notes if you want to email me, okay? Again, my name is Michelle, and you guys were great. I'm so glad that you guys were able to watch my presentation. Again, we're just informing you on some of the dangers of sitting all day, what can happen, and then ways to get moving. So when I showed you the examples, whether it's outside, whether it's at work, or whether it's indoors, get moving that way. And then the stretches as well, you want to try to do if you can. Get in a routine, okay, so that becomes easier. So pretend that you're having a schedule with the gym. You're putting down, okay, 10 o'clock a.m. tomorrow morning is the best time to do it, and just do it. So that's what's going to be really, really good when you do that, okay, to keep in the routine, because a lot of us got out of the routine. And even if you have to make a note in your planner, in your phone, set a note to at least do some sort of either yard work or outdoor work, indoor work, household chores, get moving, and some stretches, okay? So I'm going to be signing off, guys. Thank you so much, and I'll talk to you guys soon.